Infectious disease experts are warning Australians to be on the lookout for symptoms of a deadly bacterial disease that is rising along the east coast. In Queensland, cases of Group A Streptococcus, also known as Strep A, have jumped 20% and 9 people have died.
In the last 12 months in Queensland, there have been 359 Strep A cases reported, 79 more than the previous year. All 9 people who died from the infection suffered high fever and muscle aches.
This is a really nasty germ, so while in most people it just sits on the surface not doing very much, when it does become invasive in particular, it can make a nasty toxin which is really destructive and basically destroys tissue. That's why in the skin we can see that so-called flesh-eating phenomenon, and when it does become invasive, people can suffer sepsis and unfortunately a proportion of those won't survive.
Children and the elderly are among the most vulnerable.
And those who are immune compromised, and so that's why they're the groups we particularly want to make sure have that awareness and to reinforce some of those basic hygiene practices to reduce their risk, particularly as school's about to go back.
Health authorities in New South Wales and Victoria have been concerned by a spike in the number of children presenting with symptoms. The common signs include fever, a fast heart rate, cold hands and feet, sore throat, rashes, lethargy and confusion, nausea and vomiting. But some carriers can be asymptomatic.
People can have this organism either in their throats or on their skin with little or even no symptoms at all. And so that's why basic hygiene measures are so important. Things like hand hygiene, things like droplet precautions, so cough and sneeze etiquette if you do have symptoms.
A few sufferers can go on to suffer life-threatening meningitis, but the speed of intervention is crucial to survival, and doctors are urging anyone recognising the symptoms to seek urgent attention. Adam Walters, Sky News.